Good morning. This is Dr. Rutledge, and I'm going to be presenting to you some preliminary data from Dr. Kular's research using the mini gastric bypass in a unique and interesting way. And we'll be sharing you that this morning. This is preliminary data. It's not for attribution or publication. It will be presented in an upcoming meeting in the city of Indore and a meeting with about 300 other bariatric surgeons in India, period. Okay, let me go ahead and share my screen. So, what if diabetes could be reversed or cured? You can turn this off now. Here's some preliminary data, which I think to me, is earth-shaking. I think it's very important, and I think that given the diabetes pandemic that's sweeping the world now, I think that this is a appropriate time to discuss this, I think, very exciting new information from Dr. Kular and Dr. Manchanda's studies. So we're titled this Kular Hospital, A Modest Proposal. It's a discussion about the MGB and MGB2 for thin diabetics. In general, bariatric surgery has become very popular, but not much as far as the treatment of thin patients with metabolic disease, but specifically not many studies in thin diabetics. Mostly our focus has been on the obese and morbidly obese. Well, what we know now? Well, we know now that the MGB and the MGB2 can completely reverse severe diabetes for greater than 5 years, often off all medications. So that's been shown in a lot of studies, including my own and Dr. Kular's. But there's other things to think about. And so we'll go ahead and imagine if we could look at the treatment of thin diabetics. And that's important because of the rising pandemic of diabetes in India, the United States, and the world. It's also important because drugs and drug treatment, even with the best ancillary treatment of diet and exercise, the studies show only a change of hemoglobin A1C of approximately 1%. Now, we also know that in the past 100 years, the Billroth-2 has been studied in several hundred published articles, and it's always successful in improving or treating diabetes. We also know that the MGB has been successful in the treatment of diabetics, and now we're going to discuss its effectiveness in a group of 55 patients who had MGB or diabetes and were borderline or not overweight at all. So we're going to be talking today about the radical idea of the MGB for treatment of thin diabetics. And we'll also briefly mention my talk, and that's going to be about the future of the MGB2. So number one, India, this is a deadly diabetes pandemic. Giant numbers suggest that this is going to be a really tragic disease if it's not already. And so we need to work on it to treat it. Local, national, and global emergency, 425 million people worldwide, roughly 1 in 11. It's a silent killer in some cases, a massive burden on patients, families, and the healthcare system. There's a looming crisis. 77 million of one world's highest and 1 in 11 may be affected. It's an economic strain. And there's limited effectiveness of medical treatment. Medical treatment, even the best medical treatment studies, shows a delta hemoglobin A1C of approximately 1%. That's not enough to get someone from a dangerous and deadly 13, 14, or 15% hemoglobin A1C down to a healthy hemoglobin A1C less than 7. As I mentioned in the introduction, there are 100 years of data on the Billroth-2. Essentially, all of them show that they're effective at treating diabetes, sometimes just improving it, but many times completely resolving it. That means we have a potential treatment And that treatment is the basis of the mini gastric bypass. Of course, Theodore Billroth did the first uh, Billroth 2 in 1885. So that's 100, almost 140 years ago. So it's not something new. If you review PubMed, you'll find over 100 articles, animal and human, showing one way or another, Billroth 2 improves or often reverses diabetes. This we've known for over 100 years. Kular Hospital is going to discuss the resolution of 55 thin, severe diabetics at 7 years. Their preoperative hemoglobin A1C was in the deadly and dangerous zone of 12.6. At 7 years, this cohort had a hemoglobin A1C of 6.1. If it's not normal, it's very close to normal. And most off all medications and other improvements. That is, hemoglobin A1C levels cut in half off medicines with a simple 30 to 60-minute surgery. Here's our data, Dr. Kular's data. The preoperative hemoglobin A1C was approximately 13, and for years afterwards of 1, 2, 3, 4, 5, 6, and 7, hemoglobin A1C is now within the high normal range. In other words, can the MGB cure diabetes for almost a decade? This is a look at that again in a little bit more detail. So the preoperative hemoglobin A1C was approximately 12.6 on average for the entire group, and postoperatively 7, 6.7, 6.4, 6. They got better as the years went by. So we'd like to demonstrate in a few other graphs the power of the MGB to treat thin diabetics at 7 years. So here is the hemoglobin A1C at year 7, okay? And here's the hemoglobin A1C, all the different patients, one up here. That's 9 people between 5 and 6. That's normal. They are cured, reversed, whatever you want to call it. These people here, 5, 4, 9, 1, 4, all between 5 and 6, 5.5 and 6. Can we cure diabetes? 52 of 55, 94% were less than 7. Only 3 people, 5.4% and greater than 7. 1, 2, 3. 7, 7.5, and 1 lonely person out here above 8, but certainly not 13. This is the C-peptide level, and as the C-peptide level goes up, the mean hemoglobin A1C goes down at 7 years. And what this means is the C-peptide is an indication roughly of pancreatic secretion, ability to secrete insulin. And what it shows is that the C-peptide level, as it goes up, the long-term benefit of the operation goes up as well. So instead of ending at 8.4, which was in someone who had very little, almost no measurable C-peptide left, it's going to be hard to cure that person, even if you do the MGB. On the other hand, look at these people. These people here who have some residual C-peptide, they're almost all in the curative or improved range. So what that means is early operation can protect the damage to the pancreas and maybe give them a long, healthy life, maybe free of diabetes. That's a radical statement. No drug is saying that. Here's that same graph again. These are the patients who have the high hemoglobin A1C. They didn't have much residual functioning pancreas. So this suggests to us operate early. Again, same conclusion here. Normal C-peptide is 0.5. to 2. And when you get those kind of numbers, you get long-term resolution of diabetes. When you get below that, these numbers, then you get into trouble because you don't have any pancreas left to provide the insulin. This is a trend line, and here we look at the year and the age. And so as you might not be surprised, older people tend to have a higher mean hemoglobin A1C, but still 50 and 60 years and more, the hemoglobin A1C on average is spectacular. It's life as opposed to death. It's life as opposed to death, even in a 60-year or 65-year-old patient. We found very little association between hemoglobin A1C and biliopancreatic limb length. So if you look at biliopancreatic limb length used in different patients, there's essentially no association. The R squared is 0.05. So BP limb length is not critical. All you need to do is do the bypass. There's no association of BMI and delta hemoglobin A1C. So the fact that they lost more weight doesn't seem to make any difference. The difference is the effect on the ability to digest and absorb fat, which is now understood as one of the primary causes of diabetes. Here's what their ending of 7 years BMI was. Know that the normal BMI should be roughly between 18 and 25. And look at this map. Almost everyone has a perfect weight between 18, 20 in this case, and 25, except for 1 or 2, depending on how you define it. In other words, they're all normal weight. So MGB has success in treating thin diabetics. Number 1, there's knowledge and experience with the MGB. The selection criteria is clear. Treat severe thin diabetics. Mean preoperative hemoglobin A1C was 12, and at 5, 6, and 7 years, the hemoglobin A1C is down to between 6 and 7. A normal hemoglobin A1C, can you say that's a cure? It's the ideal weight. I don't know. You choose your words, whether you say cure or not. But even if it comes back, if they've had 5, 6, or 10 years free, a cold can go away. You can cure a cold, and the cold can come back. But this, to me, I would think of the word cure. But if not, you can say reversal. That's okay too. What we know now, the MGB and the MGB2 can completely reverse severe diabetes for more than 5 years. So let me say that a couple more times. What we know now is the MGB and the MGB2 can completely reverse severe diabetics now for greater than 5 years. And most of these patients are off all of their medications, including insulin. The future, that's what I'll be talking about at this upcoming meeting. It's the MGB2.